This spot hurts, and many people think it's lower back pain, but in fact, it's a problem with our sacroiliac joint. The sacroiliac joint, which is composed of the iliac bones on both sides and the sacrum in the middle, is a weight-bearing joint. During our daily life or exercise, the conduction of the entire force. It conducts from your spine to our sacroiliac joint, then passes through your hip joint, knee, and finally reaches your ankle. If during this process, instability or imbalance occurs in your lower back, including the sacroiliac joint, some joint imbalances will arise. Finally, it leads to the occurrence of pain and discomfort. Generally, problems with the sacroiliac joint can be divided into two causes. The first reason is that when we are standing, unilateral anterior rotation of the sacrum occurs, and our sacrum will also experience some relative displacement. At this time, the load-bearing and pressure on our unilateral sacroiliac joint will instead become greater. So if anyone has this condition, we can first lie flat on our back and check if the two legs are of different lengths. Then sit up and check if both legs are properly aligned. If the long sitting test is positive, that indicates your unilateral sacroiliac pain is related to sacral anterior rotation. The key is to restore the symmetry and flexibility of joints. We can lie on our back on a mat, with our knees bent and feet separated at hip width. Lift one leg and perform a single leg back bridge to restore the correct position of our sacrum and reduce pain in the sacroiliac joint. If your long sitting test is negative, it means that when you sit up, your two legs are of different lengths. Then you may have the second issue, unilateral iliac abduction, which includes some pelvic tilt. In this case, the ilium and sacrum will also experience excessive friction, mostly because you tend to put weight on one side, such as sitting slumped to one side for long periods or shifting your center of gravity to one side when standing. At this time, we need to perform some iliac adduction exercises for training. When we usually lie on the mat, you can spread your. Of course, you can also do this while lying in bed. Then, use the knee of one leg to adduct and touch the ground. Then return to the upright position and alternate by repeating the same motion on the other side. We can gradually bring our ilium into a state of adduction and internal rotation, allowing it to return to the correct position. In this way, it can also improve our unilateral sacroiliac pain. All right, this episode of the video about the sacroiliac joint will end here for now. If anyone has any issues related to lower back discomfort, please leave a comment in the comment section below. I'm Hugh, and I hope this video can help more people understand sports rehabilitation.